Hello, good afternoon everyone. Let me introduce ourselves. We are from HDB1 and we would like to present our literature review about gender dysphoria. Here is our member and the contents that we would like to explain today. Okay, first for the background. Hello, my name is Widya Rawati Widyoga with the last student number 175. As introduction for the student project, as we know, each person has their own way to express themselves. It was different from one to another, and not only in physically but in psychological aspect as well. One of it was identity. Identity is a way to express ourselves, how we understand, describe, and express what we feel to the others. It can contribute into many things such as genders, nationality, academic, or even religion. This day, gender identity has become a very sensitive topic and we can call it as a controversial content where nowadays there are a lot of different gender rather than the uncommon two which we know as female and male. Gender and sex used to be a common interchangeable term, but now it means a lot of different things. By gender and sex, it can help us to express our true identity, how we fit in the society, and all the attributes that are usually common for women and men. But during this day, there is an uncommon identity of gender. We can associate it with a syndrome that we call a gender dysphoria. As introduction, gender dysphoria is a conflict between the true gender of the person and how they express it. People with gender dysphoria have personality characteristics that are inversely related to their true or existing gender.
Good afternoon. My name is Putri Agnes Monica with 3 last number student 100. So let me explain about the prevalence of gender dysphoria. So based on the SM5 report of prevalence for gender dysphoria in the world only a few. But in 2016, based on data from CDC Behavioral Risk Factor Surveillance System, it has been reported that under 1% of adults in the United States diagnosed with gender dysphoria increased twofold compared to the previous decade. Next. Meanwhile, in Indonesia, data for gender dysphoria are more than 500,000 people with a total number of gender-related disorder of more than 3 million people. This number has expected to continue to grow and further research is needed because until now, there are still many people making medical decisions outside of professional.
Hello, my name is Chokrisin Bandel Muskawati with student number 231. So there are 6 things that are interesting to discuss based on the background. So the first one is what is the definition of gender dysphoria? Second, how to identify gender dysphoria? Third, what are the causes of gender dysphoria? The fourth, what is the pathophysiology of gender dysphoria in human body? The fifth, how to diagnose gender dysphoria? And the last one, how to treat patient with gender dysphoria. Next. For the purpose of this literature review is to understand the definition of gender dysphoria, to understand how to identify gender dysphoria, to understand the causes of gender dysphoria, to understand the pathophysiology of gender dysphoria in human body. The fifth, to understand how to diagnose gender dysphoria. And the last one, to understand how to treat patient with gender dysphoria. Next slide. The benefits. So through this literature review and presentation, by understanding those 6 aspects, the clinician will be able to manage patients with gender dysphoria properly and know the effective treatments that can be given to the patients.
I'm Vicky Samantha with the last 3 digits of student number 079. So, identity is the way an individual presents themselves, how they understand, describe, and express themselves to others. Many aspects contribute into one's identity, such as gender, nationality, academic, and religion. Throughout life, identity is affected by relationships, society, and also events, where adolescence is the most important period where someone searches for their identity. These days, gender identity is very controversial. Sex and gender used to be common interchangeable terms, but now it means very different things. The term sex is assigned at birth and used in a social, medical, and legal context to differ men and women, while the term gender is more complicated and hard to define. It associates with how someone identifies themselves, how they fit into social norms, activities, and attributes that are usually common with men or women. Anatomically, we differentiate male and female mainly by the brain structure and hormone, and the biochemical development of the genitals. Differentiation of sex follows with many factors involving lots of genes, both autosomes and allosomes, and hormones like testosterone and anti-Mullerian hormone that play a significant role in developing the male genitals, and were absent with developing to female genitals.
So my name is Claudia, I'm number 58, and now I will explain what is gender dysphoria. So gender dysphoria is when a person is not satisfied or want to change his or her gender with the other gender. So a male wants to be a female or a female wants to be a male, like that. Next, and in gender dysphoria, it is caused by a lot of factors. The first factor is the genetics, so it is hereditary. The second one is the psychosocial or environmental factors, or it can happen when the baby is still in the womb. So when the baby is made in the womb, it is not in the complete condition. So it will have some effect on the mental state.
Hello all, my name is Nareswara, student ID 135. Another definition of gender dysphoria is a person who wants to shift their appearance to the opposite gender or even want to have a sex change surgery to feel better. So people that suffering gender dysphoria, they usually feel a conflict between what they want and what they become. And it's also getting worse during their puberty, where their physical appearance is changing into something that they don't want it to be. Another thing about gender dysphoria, it's really different from like a lesbian or gay or even having a gender non-conformity. It's really different. For a transgender itself, it's usually some of the transgender could suffer gender dysphoria, but not all of them having gender dysphoria. So that's all. You can go to the next slide. Thank you.
Okay, my name is Christian Bastiantalo, number 75. There are few biological theories that is trying to explain about gender dysphoria, starting from genetic levels and prenatal alteration to high hormone levels and some external factors like stress. Central bed nucleus of the stria terminalis, which is involved in sexual dimorphism, such as sexual conduct, aggressive conduct, and the secretion of gonadotrophin, which are also affected by gonadal steroids. The main cause of gender dysphoria is still unclear, but it is thought to originate from a complex biopsychosocial link. Gender dysphoria mostly has been found in people with psychiatric illness such as schizophrenia and ASD. Some case reports have associated of gender dysphoria exposed by maternal toxoplasma infection, although additional data is needed for more evidence.
Good afternoon, my name is Beatrice Agung Saraswati, number 152. So I will explain the pathophysiology of gender dysphoria. The starting point of gender dysphoria is still not well known until now. There is a theory states that there are many genes that make gender identity a very complex multifactorial polygenetic traits. Until now, there have been no molecular genetic studies that can identify the specific gene for gender dysphoria. The development of gender into assigned sex at birth is influenced by the relationships and interaction of children with their family in childhood. For example, girls are expected to be feminine while boys are not expected to be feminine. Further research is needed for this disorder.
Good afternoon, my name is Sabudin Priyatna with name 115. So for the diagnosis, the DSM-5 have provided for one overarching diagnosis of gender dysphoria with separate specific criteria for children and for adults. For adults, The gender dysphoria diagnosis involves a difference between one's experienced or expressed genders and assigned gender and significant distress on or problems functioning. It lasts at least 6 months and is shown by at least two of the following 6 features mentioned below. Next. For children, this kind of cross-gender behavior may start within 2 to 4 years old. This gender dysphoria diagnosis involves minimal 6 of the criteria and significantly distress and bringing problems in daily life. And it is also have to be lasting for at least 6 months. And the growth and development of the secondary sexual characteristic is greatly disgusting as they feel it is wrong. This can lead to mutilation. As an example, it is common to see female patients who identify themselves as a male, which is female to male, to dress in loose clothing and wear binder to hide their breast development. Next.
My name is Brian Gervais-Delis, NIM 053. So now I'm going to explain about the differential diagnosis of gender dysphoria. There are approximately 6 differential diagnoses. The first one is transvestic disorder. Transvestic disorder involves cross-dressing as a sexual urge or fantasy. Individuals do not consider themselves the opposite gender and do not want surgery or hormones. Outside these times, they will dress and act congruent to their biological sex and gender. The second one is body dysmorphic disorder. This involves a distressing or impairing preoccupation with an imagined or slight defect in appearance. Individuals do not consider themselves a different gender, but find part of their body, possibly the genitalia or the breast, to be abnormal and want them removed. The third one is psychotic patient. Psychotic disorder may report gender dysphoria as related to a delusion by telling themselves that they are a different gender. However, this is uncommon in practice, and individual may have a history of psychotic disorder. The fourth one is borderline personality disorder. It is defined as a disturbance in self-identity, which could include sexual orientation or gender dysphoria. If a patient shows symptoms of borderline personality disorder, it is known to have a mental health professional to help in assessment. The fifth one is Asperger syndromes. They are prone to obsessive preoccupation that could include gender dysphoria. If Asperger syndrome is previously diagnosed or suspected, a review by appropriate mental professional is needed. The last one, although it is rare, dissociative identity disorder may experience gender dysphoria as one of their identities. Consultation with a mental health professional will help elucidate whether gender dysphoria is distinct from dissociative identity disorder. Thank you.
Hello, my name is Bagus Indra Nagastia. For the last 3-digit name 032. Treatment for people who have gender dysphoria can help them to find their gender role that feels comfortable for them, easing distress, and explore their gender identity. Medical treatment of gender dysphoria might include: the first one is hormone therapy, like masculinizing hormone therapy or feminizing hormone therapy. The second one is surgery, such as masculinizing surgery or feminizing surgery to modify the breast or chest, internal genitalia, external genitalia, facial features, or body contouring. The last one is behavioral health treatment. This treatment is needed to improve quality of life, self-fulfillment, and psychological well-being. Behavioral therapy isn't expected to change your gender identity. This therapy can find ways to decrease gender dysphoria.
My name is Sherti Motel Kurnia with NIM 006. So right now I'm going to summarize our presentation. So gender dysphoria is a conflict between the gender that a person had when they born with the gender they were expressed. So the main cause of this disorder is pretty much unclear because it is thought that it was originated from a complex biopsychosocial link, neurodevelopmental, complex genetic, and also psychological factors. And there are also some differential diagnoses such as transvestic disorder, body dysmorphic disorder, psychotic disorder, borderline personality disorder, Asperger's syndrome, and dissociative identity disorder. And there are treatments that we can do for people with gender dysphoria that includes medical and behavioral therapy. So next, okay, so that is it from SGDB 1, and thank you for your attention, and God bless.